from tomorrow, Monday, 15th June. The last batch of institutions in this phased approach, our educational institutions, will begin to reopen, with final year students in our tertiary colleges and universities returning to school to prepare for and take their exit examinations. As has been stated, final year senior high school, SHS3 students, together with SHS2 Go Track students, will resume on 22nd June, and final year junior high school, JHS3 students, the week after, on 29th June. The decision to include our schools in phase one of the easing of restrictions was taken advisedly. Some argue that we're putting the lives of our students, teachers, and non-teaching staff in danger by this reopening, citing the examples of other countries who have done so and recorded spikes in their infection case counts. I've stated on several occasions that there is no one-size-fits-all approach to the resolution of this pandemic. We have our own unique situation in the country, and we have always taken that into account in dealing with this disease, much as we are prepared to learn from the examples of others. Fellow Ghanaians, over the last 3 months, every aspect of our national life has been affected by this virus. We've had to take deliberate steps to ensure that our society, in the face of the pandemic, is able to function and continues to strive to deliver the results of progress, prosperity, and development for which we all yearn. Saving lives, jobs, and livelihoods, revitalizing our economy, and safeguarding the future of our country have been at the heart of this endeavor. We cannot say that because of the pandemic, we're no longer interested in issues of social justice, such as education and health. Education, indeed, is the key to the future of our country. The quality of education that our educational institutions produce ultimately will determine the success or otherwise of our nation. We therefore have to find a way of guaranteeing the prospects of the generation of young people who are the objects of education today and who represent our future. We have to do everything within our power to protect their potential and thereby help preserve our future. We cannot afford to let the pandemic undermine our chances for survival and progress. We have to confront our present and future with confidence, knowing fully well that we must remain at all times vigilant and careful. So from tomorrow, operating with half the class size, final year students will begin a 6-week period of learning to finish their respective programs. Subsequently, for a period of 4 weeks, they will sit for their exit examinations. It must be put on record that some final year students will not be returning to school, as some of them, through virtual means, have already sat their exit examinations. Prior to their return to school, government, through the Ministry of Education and the Ghana Education Service, has ensured that all tertiary institutions, public and private, have been disinfected. Universities, with their own hospitals and clinics, have been equipped with the necessary personal protective equipment and have isolation centers to deal with any positive cases. All other institutions, without their own clinics and hospitals, have been mapped to health facilities. There will be no mass gatherings and no sporting activities. Religious activities under the new protocols will be permitted. Social distancing and the wearing of face masks must become the norm on campus. To aid in this effort, a total of 600,000 face masks has been distributed to the tertiary institutions. This is to enable every student, teaching and non-teaching staff, to have 3 reusable face masks. In addition to this, 1,700 Veronica buckets, 200,000 liters of hand sanitizers, 3,400 liters of liquid soap, and 900 thermometer guns have been distributed, with the transportation and delivery of these items being overseen by the Special Logistics Team of the Government Committee, chaired by the sagacious, experienced politician, the Senior Minister, Honorable Yao Asafo-Mafo, that is supervising the reopening of the schools. I met with the Vice Chancellors of the universities, both public and private, last Tuesday, who pledged that they would cooperate to ensure that this exercise is effectively undertaken. And I thank them very much for their cooperation. Our intention is to secure the lives of the nearly 200,000 students, lecturers, and non-teaching staff who will be returning to campus from tomorrow. And I appeal to them also to do their bit to help us succeed. I urge them to adhere to enhanced personal hygiene and social distancing protocols, wash their hands with soap under running water, refrain from shaking hands, and wear their masks to, in, and from the lecture halls and on the campus generally. Fellow Ghanaians, I have to address a matter which has to deal with our case count, especially in recent weeks, and which has given cause for anxiety. The increase in numbers indicates that the virus has spread and continues to spread. We have to bear in mind at all times that the more people we test for the virus, the more people we are likely to discover as positive, and thus have the opportunity to isolate and treat them. If we do not test people for the virus, we will not find the persons who are positive, let alone isolate them from the population and treat them and prevent them from spreading the virus. For example, the total number of tests that we have conducted in Ghana, with a population of 31 million, 254,331, is one of the highest on the African continent. Furthermore, many countries in the world, including several of the developed economies, are not implementing a policy of enhanced contact tracing, and this makes our data qualitatively different and more effective in the fight against COVID-19. Indeed, the success of our tracing, testing, and treating will lead, in the end, to a reduction in the number of cases. That is what we're working for. Understandably, much focus has been placed on the rise in the total number of confirmed cases. As at midnight of 13th June, the total number of positives, cumulatively, stands at 11,964. Out of the 254,331 tests conducted, we have a total of 4,258 patients who are fully recovered, have been discharged, and are now free of the virus. So our scrutiny, in effect, must be on the number of active cases, i.e. people who remain on our books as still positive. Hence, as things stand now, the total number of people with the virus, that is active cases from our tests, is 7,652. Our positivity rate, i.e. the ratio of positive cases to total tests conducted, stands at 4.7%. In our hospitals and isolation centers, we currently have 13 persons severely ill, 6 persons critically ill, with 3 persons on ventilators. Mercifully for us, by the grace of God, the number of COVID-19 related deaths, sad though each death is, continues to remain very low, one of the lowest in Africa and the world. With 54 deaths currently reported by the Ghana Health Service thus far in Ghana, the ratio of deaths to positive cases stands at 0.4%, compared to the global average of 5.5% and the African average of 2.6%. The number of severe and critically ill also continues to be low. I am relating all these figures not to engender any false feel-good factor, but as statements of fact that must provide the context for us when we examine our figures. If indeed we are to be guided by the data, then we must look at the data in all its ramifications, not just one particular aspect of them. That is the proper way to do justice to the data. I'm thus in no way suggesting that we should let our guard down and throw out of the window the efforts we have made in bringing us this far, where we have become a reference point for many in the handling of this pandemic. On the contrary, as we begin to ease the